The femur is an important bone of the appendicular skeleton. It is the longest, strongest, and heaviest bone in the body. It supports the weight of the body and does so during everyday activities including running, jumping, and standing. The pivotal muscles and ligaments that attach to the femur bone make it a crucial component for walking. The many landmarks, their functions, and injuries to the femur will be discussed. The proximal end of the femur articulates with the acetabulum of the pelvis, creating the hip joint. The most proximal is the head, a ball-shaped smooth surface. The head contains a small central pit known as the fovea capitis, and this is a small depression for ligament attachment. Distal to the head is the neck of the femur. The neck supports the head of the femur and angles to join the shaft. The neck is the weakest part of the femur and is the location for a broken hip. The greater trochanter is located on the proximal shaft and has a lateral projection. Continuing down the intertrochanteric crest is the lesser trochanter. These landmarks are sites for muscle attachment, such as the gluteus maximus and the gluteus medius. Located on the anterior shaft of the femur is the intertrochanteric line. This bumpy ridge is an attachment site for ligaments such as the iliofemoral ligament. The iliofemoral ligament connects to the ilium and is one of the strongest ligaments in the body. The intertrochanteric crest is very similar. The thick, bumpy ridge for muscle attachment is a site for the attachment of the quadriceps femoris muscle. The intertrochanteric crest is located on the posterior surface of the bone. Continuing down the shaft on the lateral side of the femur is the gluteal tuberosity. This is another site for muscle attachment described by its name. The gluteal tuberosity is the attachment site for the gluteus maximus muscle. Below the gluteal tuberosity is the linea aspera. The linea aspera is a rough surface on the posterior surface of the femur shaft, allows for attachment of the vastus medialis, vastus lateralis, adductor brevis, magnus longus, and the short head of the biceps femoris. The distal end of the femur articulates with the tibia and patella, forming the knee joint. The medial and lateral condyles are the round ends of the femur. The condyles are covered with articular cartilage. The lateral condyle is proximal, flat, and less prominent than the medial condyle. These knob-like structures contribute to the knee, creating a hinge joint. The medial and lateral epicondyles are the bony surfaces superior to the condyles. These are the sites for ligament attachment for the knee joint. The medial epicondyle connects with the tibia by the tibial collateral ligament, and the lateral epicondyle connecting with the fibula by the fibular collateral ligament. The tibial collateral ligament and the fibular collateral ligament are both components of the knee joint. Located on the posterior surface of the femur, between the two condyles, is the depression, the intercondylar fossa, an attachment site for internal knee ligaments. The anterior cruciate ligament attaches to the lateral wall of the intercondylar fossa. The medial wall is the attachment site for the posterior cruciate ligament. These ligaments are a part of the knee joint. Located anteriorly between the two condyles is the patellar surface. The smooth patellar surface articulates with the patella. The hip joint is a ball and socket joint between the head of the femur and the acetabulum of the pelvis. It is very unlikely for this joint to be dislocated due to the head of the femur being larger than the diameter of the labrum. The labrum is the cartilage that surrounds the acetabulum, engulfing the head of the femur and creating a deep and stable joint. As it is the largest and strongest bone in the body, the femur is not easily broken. However, one of the most common injuries of the femur is hip fracture. There are several places the fracture can occur: femoral neck, intertrochanteric, and intracapsular. A femoral neck fracture occurs at the neck of the femur and can be very dangerous, as it may cut off blood circulation of the hip. An intertrochanteric hip fracture occurs distally and laterally from the joint. This one isn't as dangerous and blood flow isn't affected. An intracapsular fracture involves the ball and socket portions of the hip. These types of fractures can occur from hard and high falls, blunt force to the hip, diseases such as osteoporosis, and obesity. Osteoporosis is one of the most common causes of hip fractures. Osteoporosis occurs when the bone becomes weak and the mass of the bone is reduced. Therefore, the bone is more porous and brittle, causing the bone to fracture easy. An osteoporotic fracture occurs at the neck of the femur. There are several risk factors when it comes to osteoporosis. Age, race, and gender all play a role. Osteoporosis is more common in those of old age, white or Asian ethnicity, and women. The femur, or thigh bone, supports the whole body while standing and during activity. The femur articulates with the hip and knee. The many landmarks on the bone are for muscle attachments and ligament sites. The femur bone also participates in two important joints, the ball and socket of the hip and the hinge joint of the knee. The femur plays an important role in movement due to the joints it contributes to and the many muscles that attach to it.